and then we're going to get going here. Let me put it into speaker view. All right. Okay. All right, thank you, everybody. Good morning. My name is Phil Bridges. I'm with UNC Health and Communications. My colleague, Alan Wolf, and I will be your moderators today. And in following comments from our speakers, we'll take as many questions from the media as we can possibly work in. You can ask anything you like, and we will do our best to get it answered for you. It is very hard to believe that it's been a full year today, March 3rd, since the first case of COVID-19 was documented here in North Carolina. In the past year, the pandemic, the UNC Medical Center in Chapel Hill has performed more than 250,000 COVID tests, Dr. Miller told us just this morning. And that's a 450% increase in annual testing volume for the lab for a year. And then UNC Health as a system, we've administered nearly 200,000 COVID-19 vaccines already. So today what we're going to do is going to take a look back at the past year and then also hopefully take a look forward. And our featured speaker this morning is Dr. Wesley Burks. Dr. Burks is CEO of UNC Health. He is also the Dean of the UNC School of Medicine and Vice Chancellor for Medical Affairs at UNC Chapel Hill. Dr. Burks will address the response to the COVID-19 by UNC Health and the School of Medicine over the past year. That's included testing, development, implementation, vaccine, clinical trials, and of course, clinical trial for many, many COVID patients across the state. Dr. Burks has spent more than 30 years taking care of patients, conducting research, helping educate trainees, and leading institutions. So at this time, we will turn it over to Dr. Wesley Burks. Dr. Burks, the floor is yours.
So Phil, thank you, and thank the rest of you for being here with us this morning. It's just an opportunity for each of us to share our experiences and really what we've learned over the last year. As I thought about this, hope through the perspective of the people, the experts that we have and what they share, that you'll understand what happened for us, what it was like, and some hopefully about where we're going. Today, obviously, is the anniversary of the first COVID-19 cases here in North Carolina. And last week, the country passed 500,000 deaths, which like those numbers really seem like just hard to comprehend at times. But our teams, including the people with you today, they spent the last year caring for COVID patients, caring for each other. And behind the numbers that they've seen, they could tell you many, many, many personal stories that will illustrate where we've been. For me personally, and I know for us as an organization, the last year has been interesting, frightening at times, amazing, filled with a sense of purpose, unlike any other time that I can imagine. But above all, it's just been plain hard for each one of us. I know for each of you on the Zoom today, it's been the same. Between the many professional and personal challenges that all of us have had through the pandemic, then we've had, on top of that, financial insecurity issues for individuals and families, social and political unrest through the fall and winter, kids at home and trying to teach them, that is just really difficult. Most of our holidays that we normally celebrated where my colleagues were in the hospital caring for patients and others unable to gather with their families. There were so many unique issues for each one of us that we faced that made the year really the difficult time that it's been. I know all of us have faced different challenges, but of the many memories I have for us collectively is that how it's really forced those connections that we have normally that have been separated between our personal and professional lives. We've developed relationships even through this pinhole camera and seeing you on the screen, stronger relationships that will help us go forward in the years to come. Looking back for me personally over the last year, there's so many memories and lessons. I thought about all of those, or a lot of those. I wrote many of them down. I kept a file through the year just to think about it. I remember the countless hours of worry and concern and loss of sleep about all of the people that we work with, trying to ensure that they had everything they needed to take care of patients and be safe at the same time, and how difficult, particularly early on, that was. I can remember many times being concerned about my parents who live out of state and hoping they would stay safe and not catch a disease that would be pretty devastating for their age group. I have memories here of people working really hard to set up new testing processes and kits, setting up respiratory diagnostic centers all across the state that weren't there just a few days before, that took care of hundreds of thousands of people, starting our vaccine sites in just a few weeks with a process that's really unmatched across the state. I have very distinct memories of watching the first immunization here at the medical center, and then me getting my first dose in that same place a few months later. We knew that we had a great team of dedicated people that we're fortunate to work with, but it truly has been, and I can't say this enough, amazing to see their willingness to go really above and beyond, both personally and collectively, to work harder than they ever have without losing the empathy and grace that they work with each other, that they show to each other. Today at UNC Health, this is our day of reflection. And as I think about what things were like a year ago, then we weren't sure what was going to happen. We definitely didn't think we'd be here today still talking about it. But through all of this work, we are different, both collectively and personally. And I think we're different in ways that may take a few years to better understand. But throughout all of it, and I've said this repeatedly, what has brought me comfort and confidence has been the dedication of the people that I work with, my colleagues. What we've accomplished this year, this long year, is because of each of those individuals working personally and collectively. And I feel fortunate as I look at my Hollywood Squares here today to work with them. I'm fortunate that they're the leaders that they are, that they have the content knowledge that they have for their respective areas. As I look at each one of them, I'd be remiss if I didn't thank you. As I said to David earlier, I've seen him more online in the news than I have personally in the last year. And it's been comforting every time I see him and the rest of you to go, yeah, they know what they're talking about. They're being reassuring. They know the right things to do. They played important roles in educating the community broadly, dispelling myths, sharing facts. And I hope each of you that I have the occasion right now to say that you take some time to reflect on what you've done and what's different for you through this past year. So I'm going to ask each of my colleagues to introduce themselves and share one significant thing that they've learned over the past year, and then we'll open it up, as Phil said, to your questions. So thank you for being with us today.
Okay, your UNC experts. Alan, you want to walk the folks through?
Sure, happy to. Thank you all for joining us. So we have some pretty heavy hitters with us today. Thank you all for joining us. Dr. Alexis Miasis-Malchuk is an assistant professor at the UNC Department of Family Medicine. Dr. Samantha Meltzer-Brody is chair of the UNC Department of Psychiatry. Dr. Melissa Miller is director of the UNC Clinical Molecular Microbiology Laboratory. Dr. David Weber is professor of infectious diseases and medical director of infection prevention at UNC Medical Center. Dr. David Wall is professor of infectious diseases and principal investigator of the ACTIV-2 clinical trial. All of them will say a few opening remarks, and then we'll open it up to questions that you can direct to one of them or just to the general group. Alexa, do you want to kick us off?
Yeah, absolutely. Thanks for the introduction. Very happy to be here. Even though the circumstances, like Dr. Birx had said, is not what we expected. None of us could have anticipated that a year later we'd still be fighting this pandemic. So I'm Alexa Miasis-Malchuk. I'm a board certified family physician and assistant professor in the Department of Family Medicine. And as a family physician, one of the things that I really pride myself on is getting to know my patients and getting to know their personal stories. As a family physician, I also have formal training in understanding the social drivers of health, right? So not just the disease processes that I see manifest in the patients that I care for, but what are the things about their lives outside of the clinic or outside of the hospital that impacts their health? And the thing that drew me to family medicine was an opportunity to work to achieve social justice or health equity. Because, like I said, as a family physician, I care for patients of all ages, of all gender identities, and their family members, and think about them not just as individuals, but also within the context of their community. And so when the pandemic hit, for me personally, there was a lot of uncertainty and relentless need to be flexible as quarantine and PPE precautions, and we've had a lot of procedural changes as we responded to the emerging pandemic. But what this meant was that I got to care for patients throughout this difficult time before they were ever even diagnosed with COVID. And many of my patients were diagnosed with COVID. And I got to care for them while they were in the hospital, not on a COVID unit, but perhaps suffering from long-term complications from their COVID illness. And then I get to care for my patients after they're discharged from the hospital and kind of help them walk through their recovery. And so, like I said earlier, I really pride myself on getting to know my patients very well individually, learning their stories and allowing that to help guide decision-making to keep them healthy. But the one thing that I really learned this year was the power of sharing my own story. So what this COVID pandemic has done is shown a spotlight on health inequities that have existed in this country for decades. But it's the first time that, a global illness has really brought these things to the forefront and grabbed everyone's attention. Now, as a physician, but also as a woman and as a person of color, and as somebody who grew up in a lower socioeconomic background, I have a lot of personal experience with some of the inequities that I see in my own patient population, and was able to share my own story and use it as a powerful tool to educate my patients and also encourage them to undergo COVID vaccination. And so I'm happy to talk more about that later, but this past year, I've spent a lot of my time just sharing my own story and what my experience was like getting the COVID vaccine, and encouraging members of my community to do the same.
Thank you. Dr. Meltzer-Brody, you want to say a few quick remarks?
Sure. Good morning, everyone. It's a pleasure to be here. I wanted to share some thoughts about psychiatry, mental health, and behavioral health. There is no doubt that the COVID pandemic has had a profound and what we will see as an enduring impact on mental health. And none of us have gotten off scot-free without this impacting us personally, our families, friends, or colleagues. We've seen the prevalence of anxiety and depression increase 3 to 4 times. This is CDC data. We've seen addiction rates soar, and we've seen a devastating impact on kids and adolescents. I'm enormously grateful and just want to thank Dr. Birx and UNC Health and the School of Medicine for their enormous support. We have been able to rise to the occasion during this time because of the support of UNC Health and the School of Medicine in taking care of our healthcare co-workers broadly and the population of patients we have the privilege to serve in North Carolina. We have taken care of and provided for emotional PPE in addition to physical PPE, and this has made all the difference. And out of this enormous suffering, because there has been profound emotional suffering, one of the most heartwarming things is the sort of transformative nature on how we deliver care. And with telepsychiatry hitting last March, we rapidly transformed, and as the payers paid for behavioral health and other services at parity, we are now been able to provide mental health care broadly across the state to reach people in ways never before. That has been remarkable and has done a number of things. We are able to markedly increase the volume of patients we care for, and the no-show rate is down to 0. Collectively, we are able to take care of behavioral health needs much earlier with experts to hopefully decrease suffering and prevent long-lasting damage. And so I would say in sum, I think this is a time of tremendous impact, but also tremendous opportunities that we are looking forward to do all we can to serve the people that we have the privilege to take care of as part of UNC Health, and to really see this as a watershed moment to do differently and do better that can have really meaningful impact.
Thank you. Dr. Miller?
Yes, thank you. You know, it's painful sometimes to look back. You know, I think back a year ago today. My husband reminded me this morning when I was telling him it's a year ago today that the first patient in North Carolina was diagnosed with COVID. He was like, oh, this is also the anniversary of your all-nighter weekend in the laboratory. So at this point, a year ago, we had developed a test. This was before any commercial tests were available. And we're negotiating with the FDA on getting emergency use authorization so we could start using it on patients. We didn't start testing until the RDCs opened up on March 16th, that Monday. And I remember we were so proud. We were able to start with 100 to 120 tests in a day. And that was pretty overwhelming at the time. So in the last year, we've done 250,000 tests just at the medical center. If you look at UNC Health wide, we also help bring up testing at our affiliate labs so that they had some local testing once commercial tests were available. We've done almost 350,000 tests statewide. So it's a pretty remarkable accomplishment for the laboratory. Our laboratory staff has gone to 24/7. We have 3 times the number of technologists in the lab doing the testing. But to really piggyback on what we've heard already a little bit this morning, it certainly was not without its pain points. And, you know, the mother and me, you know, at home, and also the mother of the lab, have been very worried about the lab staff. You know, you hear a lot about frontline employees and the nurses and physicians, which of course this has taken a large toll on, but it's taken a large toll on the laboratory employees as well. And so one silver lining I've seen in the last year is, you know, the lab's normally this black box and you don't think about it so much, and that's okay. You shouldn't have to think about it that much. And for the first time, people are really seeing what the lab does, what the lab can step up to do, and how important to patient care our laboratory tests are. So it's both with great sadness and pain that I look back at what we've been through in the last year, but also the hope that we have in front of us going forward makes me very proud to work at UNC Health.
Thank you. Dr. Weber?
Thank you. I want to thank everyone for joining us today, and I want to particularly thank all of my colleagues on the phone who have immeasurably helped UNC with their response to this pandemic, both helping our colleagues, helping our patients, and helping the state. As you all know, that this pandemic is worldwide. We are now in the United States in the third surge, which was the highest in January and February. Fortunately, we're heading down, but we now seem to be stabilizing countrywide at a level that is where we were at the second surge in June. So we certainly have trying times ahead of us. I'll talk more about that. We have learned a great deal about this virus. We know it's largely aerosol transmitted, and more important, we know how to prevent people from getting infected. As the CDC and public health experts have stated, wear masks whenever you're outside of your home bubble, physical distancing, ideally 6 feet away, use appropriate hand antiseptics like alcohol frequently, disinfect contaminated surfaces, and as soon as you're eligible, receive the vaccine. So we can now see a light at the end of the tunnel. UNC, just the medical center alone, has treated more than 1,700 patients. Our infection prevention department has worked very hard to follow those mitigation steps. And I want to point out to you that they really do work. We have had, despite this large number of patients, not a single one of our healthcare providers working in a COVID unit, working in our respiratory diagnostic center with Dr. Wohl, where we do the testing that goes to Dr. Miller's lab, or in our emergency department, have acquired COVID as a result of working here in the hospital. So we do know how to prevent transmission of this virus. I also want to point out to you that UNC is one of the leading research, if not the leading research institutions in the United States for COVID. many, many excellent basic scientists like Dr. Ralph Baric working on new drugs, having developed remdesivir and others. I serve as the chair of our institutional review board. We have more than 400 IRB-approved human research protocols that cover almost every single aspect of epidemiology, learning about the disease, treatment, vaccines, and I'm sure Dr. Wall will speak more about that. I just want to mention two other things. In mid-January, we opened a post-acute care clinic for people who have ongoing sequelae, what's now called the post-acute sequelae COVID, which up to 30 to 60% of patients, even those with mild disease, never hospitalized, have ongoing symptoms. We've opened up a multi-specialty clinic under the leadership of Dr. Broder and physical medicine rehab, and we're open to take referrals and then the initial screening there, and they can be followed up as needed by psychiatry, neurology, infectious disease, and others. And finally, I was asked to speak a little bit about protections with the current ability to give everybody vaccine by May, and given the number of people who have already been infected, it's likely we'll begin to reach community protection levels at the end of May or in June, meaning 85% of the population's either had vaccine or natural disease. This is not a get out of jail free card. If you are susceptible and you're at risk and you come into direct contact with somebody with COVID, you will still be able to get COVID, but it will dramatically drive down the rates of new disease. So I do see by the end of summer that many of the aspects of daily life we've had to alter may change. And the major concern in the future really is the development of variants that escape vaccine and or therapy. But both the drug companies working on new therapies and the vaccine companies working on potentially booster doses that cover these variants give us hope that by the end of the year, life will return mostly to normal. Thank you very much.
Thank you. Last but not least, Dr. Wall.
Thank you, Alan. Dr. Birx, thanks for asking the question. It's an important one. I think for me, I really am struck by the parallels that we see across pandemics, right? So some of us, many of us on the screen have dealt with other infectious disease crises. What's common amongst them are the fear that they sow, the confusion. People lose their bearings when they're worried that they can get sick and the people they care most about in the world can get sick. These pandemics, as we've seen, whether it be HIV or Ebola or now COVID-19, also do find, as Dr. Malchuk mentioned, those who are the most ignored and marginalized and maligned across the world. And pathogens take advantage of that. But I think also I've seen across these crises, there's opportunities too, and I really do mean this sincerely, for leadership. And while on a national stage, we've seen leadership that has been sometimes lacking, I think more locally, Dr. Birx's example and what we've seen across the UNC healthcare system, leadership that has enabled us to do what we needed to do, whether that be in the hospital or in the laboratory or in a parking lot, swabbing people's noses and going out to farms and doing that. And these were enabled by leadership. At the hospital, each hospital level, creativity, setting up tents in parking lots to take care of people who are sick with COVID-19 because they had to. Here at our own hospital, down to the individual units where nurse managers, respiratory therapists are making really critical decisions and leading by example, being the first to go in, the first to use PPE and show everyone else how to do it. Our laboratory just standing up and almost never saying no. I mean, and that's just what we've been talking about, never saying no, unless there's a really good reason to say no. And sometimes there are good reasons to say no. And lastly, I've just been really struck how there's so many people I didn't really even know existed at UNC Health and across the campus who just came almost out of the woodwork. I didn't realize there was a place in Morrisville where people worked and did all these operational type things that really kept us flowing. And that's the wind that's kept our sails, puffed out and kept us moving forward. So I've been really impressed by them and the community examples that we set. So overall, this has been a horrible year, but there have been these shining examples of what we can do. And it really does really impress upon me that I made a really good decision in deciding to come to UNC and stay here.
Wow, that's great. Alan, anyone else we need to catch? Did we get everybody?
We're good.
All right, well,
We can
let's
open up
take,
the media questions.
all right, let's take questions from the media. As you know, we're pretty flexible in this. Just jump in and ask your question. We've got so many folks on, there's really no other way to do it. And we're not going to screen anything. You can ask anything you like, and we will answer it if we can. Go right ahead.
This is Richard Stradling at the News and Observer. Appreciate you all doing this. I got a chance to ask this question of Dr. Wall yesterday, and I want to ask the rest of you about how we should feel about where we are right now. The numbers, the new cases have come down. Hospitalizations are about half where they were a month ago. Schools are starting to admit students. The Carolina Hurricanes are going to have some fans. Texas is doing away with its mask mandate. Is it too soon to be doing some of those things? And have we turned a corner for good, or how should we feel about where we are at the moment?
I'll answer that question first. I think, as you may have heard before, I think we should be cautiously optimistic, right? I mean, we've made it through this past year, which, as Dr. Wohl said, has been a horrible year. And, having 3 vaccines approved that are effective at preventing COVID symptoms, like, this is very exciting, but at the same time, this is not the time to celebrate too much and start relaxing all of the measures that have gotten us thus far. I think, as in the year to come, the things that we need to focus on is how to make sure that everyone, not just in the state, but within the nation, are vaccinated, and what some sort of return to normalcy may look like. Although I don't think we will ever go back to, at least not in my lifetime, to what things were like prior to the pandemic.
Hi, this is Celeste Gracia with WUNC. I have a couple of different questions. First is numbers, which you guys may have mentioned, but maybe I missed. I'm wondering how many vaccines UNC Health has administered in total, and how many COVID patients y'all have treated since the start of the pandemic. And then my second question is, certainly today is a day of reflection with this 1-year anniversary, but moving forward, what are all of you looking to now?
So I can start with that. UNC, just the medical center alone, has treated over 1,700 patients with COVID, many more across UNC Health among our many different hospitals. We're approaching, and sometime this week will exceed 200,000 doses of vaccine delivered, and have something on the order of 40,000 plus individuals already with scheduled appointments for additional vaccine. UNC has made the absolute commitment that whatever vaccine we get, we will use, and our only limitation so far has been the amount of vaccine we received. We have approximately 15 vaccine sites open and working in approximately 12 counties, along with a mobile vaccine distribution center opening.
This is Dr.
Judith.
I just wanted to comment briefly on that. There's a lot being written about the next wave and the mental health tsunami we're experiencing, what is expected to come next when people come out of this, and the impact of the trauma on so many communities. So there are multiple communities that have been profoundly impacted with enormous loss, suffering, death, underrepresented groups, other vulnerable groups. Our kids and adolescents have suffered profoundly during this time, and many other people have too. And I think that as we can be cautiously optimistic moving forward, the mental health toll in those suffering from trauma, I am deeply worried about our children broadly. And we cannot have a traumatized population of kids that don't get the help they need, because that will really set them back and have long-lasting consequences. We are looking and trying to take a very proactive approach on how we get appropriate broad-based mental health services across North Carolina to our kids and adolescents in particular. So I think we celebrate that there's progress and we all have great hope and optimism, but the mental health impact and the trauma, the real trauma that can be enduring has to be addressed, and we have to be taking active approaches on how we're going to manage that effectively for best long-term outcomes.
Anthony Wilson from ABC 11. Can you update the situation of the first person who was diagnosed? How is that person doing today? If you don't.
I believe that patient was not actually hospitalized, if that's correct. Is that correct, Dr. Weber? That the very first person who was diagnosed was not actually hospitalized. They were treated at home. And they weren't treated at UNC either. I don't believe. Is that correct?
I believe that's correct.
Good morning. This is Judith with CBS 17 News. My question is about vaccine efficacy. I think some people are looking at the percentage of efficacy for the J&J vaccine and are maybe worried about, it being lower than the other two. How do you reassure people that, to continue to get the vaccine? And can you kind of explain where that efficacy comes from and what the average person should know about that percentage number?
David, you want to take that?
Yeah, and I'm interested in others' feedback too. So I think it's a really important and good question. So we know that the Pfizer and Moderna vaccines were tested in tens of thousands of people, and we're told the efficacy was about 95%. What that means is of all the people who got COVID-19 in those trials, 95% of them were in the placebo arm. So that gives you a sense of what that efficacy means. For the J&J vaccine, which we just have really a press release and some data that were submitted to the FDA, so we don't have a full published paper, we're seeing efficacy of around 65 to 70%. Part of the challenge in comparing one study to another is where they were done and when they were done. So the J&J vaccine trial was done more recently and was done in countries where there are these variants, these worrisome variants that vaccines may not cover as well as they do the virus that's more predominant now and was more predominant when Pfizer and Moderna were doing their trials. The good news is when you look at the data from the US, for us who live here at least, the J&J vaccine did better. And when you look at preventing severe COVID-19 hospitalizations and death, it looks just as good as the Moderna and Pfizer vaccines. So I feel the benefits of having one shot, being one and done, are really important for a lot of people. But I do believe people should look at the data as much as we can share with them and explain it to them and make some decisions for themselves. So I think we're trying to do that at UNC Healthcare very clearly and very transparently. But if it was me, just to be personal, me or my family, I would have no problem taking the J&J vaccine if I showed up and that's what was available, if that's the appointment I can get. My kids will get vaccinated. If it's the J&J vaccine, that's fine.
I'd like to make a couple of additional comments to Dr. Wells' excellent thoughts. One is the J&J vaccine does have lower severe adverse events. So the Pfizer-Moderna vaccine had about 15% where they had a grade 3 event, meaning interfered with daily life functions like combing your hair. I don't want people to think they have very serious side effects. They don't. But the J&J vaccine had under 1%. So that is an advantage there. The other thing is that we had not known whether the vaccine certainly prevented you from becoming ill, getting hospitalized and dying. But there's now recent data, particularly a very nice study out of Israel, that suggests that these vaccines also prevent you from becoming infected. And if you don't become infected, you can't become infectious. So that is something we're beginning to learn. There are more studies that will be underway, but that is also very good news as well.
I also just want to add from an access standpoint, the Johnson & Johnson vaccine doesn't have to be stored at those much, much colder temperatures, like our first 2 vaccines that have been approved for use. So the Johnson & Johnson vaccine can be stored for up to 3 months at regular refrigerated temperatures. And also the fact that it's one shot makes it much easier to vaccinate people more quickly and not have to worry about them coming back for the second dose. So from an access standpoint and trying to reach communities that can benefit most from being vaccinated, as they're the ones that may be hardest hit, this is a great development.
Elizabeth Wheelis. Oh, I'm so sorry. Go ahead.
No, just let me just jump in real quick. I had a question came to me from text. From the chat function. Dr. Birx, the question was, what has been the effect on the UNC health system? Because we think of the Chapel Hill in Raleigh is the main center, but it's a statewide organization. What's been the effect on the larger organization?
So Phil, thank you. From the big picture for UNC Health as a system, then the patient care that we've delivered, the care that we've delivered for each other, and as we provided that care, and then the financial impact have all been huge for the system as we've seen it. As you walk through the last year, the differential effect of initially people that traveled that came back to the urban areas, the spread in the rural areas, and then back to the urban areas, the increase initially in November, December in the rural, and then the urban and the more densely populated areas, it's traveled across the state and had differential effects. And so our healthcare institutions, the hospitals, are in different parts of the state. So they've each felt that effect at different points throughout the year that we've talked about. Someone alluded to earlier the ability of people that we work with at Caldwell and their local partners set up a tent hospital. They made a decision, and within a week they had several tents up, and they took care of up to 40 people in that tent city because of the differential effect on that particular location at that time.
Elizabeth Wheelis with Carolina Connection. I'm wondering, what will the difficulties be to distribute a vaccine in a university setting?
So I'm not quite sure what the question is, but I will say that across the UNC university settings, our multiple universities and colleges, we are now providing vaccine centers through those universities and colleges with a particular preference or aim to focus on the historically Black universities and those universities that are in more rural settings, and those vaccine centers are up and running. These are for the public, not for students and faculty. But obviously, now that we've moved to phase 3, and among the essential workers who are eligible are university faculty and staff who are not working at home. And so those people will be immunized as well.
So can I hear a lot of cautious optimism from folks, and at the risk of being Debbie Downer, tell me what you folks are thinking about the variants that are currently circulating and what they could mean for the remainder of the pandemic.
It's amazing what a fresh perspective can teach us.
Can comment a little bit about the variants, and we are actively looking at this. We're collaborating with 2 laboratories on campus to sequence right now. We're doing every positive specimen that has enough virus there. We're sequencing to see what clade, which type of SARS-CoV-2 virus it is, what mutations it has. Do the mutations tell us anything about how they might work in diagnostic tests? Would we miss any with these mutations, how they work with monoclonal antibodies based upon what's known, and others can certainly comment more about that. And then of course the vaccine. So the good news is, so far of the ones that we have sequenced, there are only 2 of the what's B117 or the UK strain that we've had circulating in our population, and none of the other variants yet, but they're definitely here. We expect them to increase. So I'll let others talk about the clinical aspect of that, but just know we are carefully monitoring this.
Yeah, I think the two concerns that people have real briefly about the variants from the clinical aspect, in addition to them being probably more infectious and maybe making people sicker, certainly more vulnerable people, is whether or not our vaccines are going to work. And as I mentioned, for the J&J vaccine, interestingly enough, it was stress tested in South Africa, where 95% of the folks who did get COVID-19 had the variant that we call the South African variant, for lack of a more convenient term, and it worked. So that really is very exciting, but probably does take a chink out of the armor. And so variants, these are not the last variants we'll see. There'll be more variants because viruses mutate and they change, especially if we keep transmitting it to each other, because that just gives more opportunities for variants to spread and gives Melissa more work to do every day. So fewer isolates, fewer variants. And then whether or not our therapies, and we haven't talked about therapies, but there are therapeutics that are out there now under authorization from the FDA and are being developed. And these variants could have an impact on those too. We know that's already happened for the existing therapies that are out there.
But I should say the bright part of this is that particularly with RNA vaccines, they can be made much more quickly. And if the FDA allows, much like we do influenza vaccine each year, doesn't require a whole new trial, but just simply demonstrating that the vaccine is safe and you develop antibodies from it, then the companies, once everyone in the population's been immunized, can turn their production lines to making boosted doses in a potentially much shorter time frame than the initial time from developing the vaccine, much like for influenza. It's too early to talk about the need for boosted doses, but the technology does exist to make them more rapidly, and as the production lines increase, not to have the long lags for vaccine production.
So Phil,
question came in on, oh, go ahead, please. No,
yeah,
go
Phil
ahead.
and Alan, I was going to comment on Jason and then Sarah's question about health inequities and the effects that we've seen as a system. The lessons that we've learned both about the healthcare part in treating patients that possibly could have COVID in the vaccine space, we've learned a lot in both of those. The taking care of patients, we have a group of people that have not had access to easily primary care, as that Alexa talked about earlier. We have a population of people that had other significant comorbidities that had an effect on outcome. That lack of communication from healthcare systems to the different communities was significant. And we understood that. This magnified the understanding of that and caused us to change how we do things as a system. Through the late summer and fall, we developed a system-wide diversity, equity, and inclusion council that was both for inward, how we take care of each other, our colleagues and our coworkers across the system, also to begin to address in a more specific way the health inequities that we see across the state. The School of Medicine, the School of Public Health here, others across the campus for decades have been working in health inequities. And now that's really up to the UNC Health and the healthcare systems to take that research that's been done and really make a difference in the communities. From a vaccine standpoint, what we've seen is the differential uptake in those that had the ability to get on a computer, to get online, to refresh their computer hundreds of times, to have transportation to go get a vaccine. And so quickly we had to switch how we were trying to get in touch with people to tell them about the availability of vaccines. And so one big example in one of the counties in the East, we had our vaccine site there had more people driving 75 to 100 miles to get vaccinated there from Wake County than we did in the local county. And so we switched to making robocalls to the community. And we were really able to get landlines. A lot of them weren't there, but out of that emphasis, we went from in one of our sites to having most people from Wake County getting vaccinated there to that site. Almost 50% of them were from the Black community that got their vaccinations. We've also upfitted a mobile van that's gone to several of the rural and underserved communities. In that mobile van, we have other groups that are just going to the local community centers and local churches 10 days ago, I visited a group that went to a local church in Kinley, and they were there. They'd made appointments for the people in the rural areas that had come into Kinley to get their vaccines. So we had a group of 10 people working really hard to have an orderly process. People that came in, got their vaccines, got the information they needed, and we'll come back in 3 weeks to get the same vaccine process. Then others can add on to what you know from what I just described, though.
I think that's right. And to add on to what Dr. Burke said, I help run the Friday Center in Hillsborough Hospital vaccine clinics. This is something we take extremely seriously. And working with the system as a whole, I can tell you, these are not one-offs. There is a comprehensive program with a dedicated staff and team looking at how do we make vaccines more acceptable and accessible to people across North Carolina, with special attention, again, to groups that may have some good reasons to be skeptical about these vaccines. And so there's been a whole host of initiatives. The ones that Dr. Burks mentioned are really key, including the pop-up and mobile testing that's going on and vaccination at the same time out east. We're working with that same group just yesterday on the call to bring this to, now that the farm workers are back from the South and now working again, making sure we have vaccine available for them, but also education. We're working really closely with our health departments, Orange County, Chatham County, Lee, Wake, so that we can work together. If they have wait lists for people who want to get vaccinated, or people that have a hard time getting to vaccine centers, plus they can't have transportation, or they're living in a, in a double wide in a rural area, we're working on ways that we can get them vaccine. The last thing I'll say is we spent a lot of time doing the kind of outreach Dr. Burks mentioned, not only robocalls, but we're inviting community partners to identify those who are hand raisers. These are people who want the vaccine, but just can't compete to get online, to use apps that get them through phone trees and all that sort of stuff. So working with community partners that know their population, that are trusted by their population, to help us connect with them, and we help them make appointments so that they can get a vaccine. So these are things that are going on across the state and across the area and are already having an impact, because we measure this day by day. What proportion of the people we're reaching are the folks that we want to make sure are reached?
I'd like to add just a couple of things. One, this is not new for us. We did this going back to March last year, when we began working hard to make sure there was equitable access to testing. Dr. Woe was very involved in that. Dr. Miller using mobile vans, again, with community partners and others. We've had a large outreach to helping nursing homes and extended care facilities with both testing and management across the state. So this is not a new effort. This has been going on for as long as we've had the pandemic, with those important outreach efforts from the medical center and from indeed all of UNC Health and indeed all of UNC.
Alan and Phil, one additional comment in this space. UNC Health is an academic healthcare system. And so what that means, as we say that, is that we have clinical care, education, and research going on, big picture, all across our system. The uniqueness of UNC Health from any other academic healthcare system, and it's been there for a long time, is a culture of commitment to our communities. And the manifestation of what David and others have just talked about is that commitment that we've had for a long time to the community of North Carolina, the people of North Carolina. And again, that's the manifestation of what we're talking about.
Last plug I'll just say is that Jason and Sarah, check back in another week. We're starting a barbershop and salon initiative where we could disseminate information throughout Chapel Hill, Durham, probably Winston-Salem, to spread word about opportunities, including getting treatment, getting vaccinated, joining a research study. And those partners in these salons and barbershops are really excited about it. So we hope we could get some attention to that too eventually.
I should also add, we've, along with Duke in a partnership, we've been working hard with the K through 12 schools. We have involved in phone calls every week with the Durham, Orange, Wake, and Chapel Hill Carrboro superintendents, and we've rolled out help with mitigation across North Carolina for safely reopening K through 12 schools, as well as yet another initiative to help the community.
Additional questions from the media, please just ask away. Well, there's one chat question. There's a clarification. The 200,000 doses, I don't know if anyone wants to address that. Is that across statewide? And I believe it is, but I'm not going to be the one to answer that. It should be you guys.
Yes, it is.
Yes, yes. All right, any additional questions for us? We've got a few more minutes. We said we'd go to 11:15. Any questions whatsoever?
Judith with CBS 17 News again. I guess I do have another question about, yesterday the president announced that there would be enough vaccine for everyone by the end of, I think he said May. Is that even if we have these vaccines, is it realistic to think that everyone will be vaccinated by then? Or does that just mean that we have it in hand and now we just have to wait to get it in the arms? Like, what does that timeline really mean?
So you're exactly right. It doesn't mean everyone will get them. Our first focus, of course, is having enough vaccine for everyone who wants it. But our focus, both simultaneously and which will continue, is to help eliminate vaccine hesitancy. We've done that by an FAQ sheet that we've questions that by obviously dealing with the media here with fact and question sheets, town halls, multiple different ways of just answering people's questions, concerns about the vaccine with lots of education and outreach. I do want to point out, like for Johnson & Johnson, which just was released, we've already translated all of our information into Spanish, so we can disseminate it in people's native language. But we will have to continue to deal with vaccine hesitancy. One of the issues that is in favor of helping with that is in the trials, unlike many previous trials, there was large representation from African Americans, roughly 10% in the Pfizer and Moderna trials, and even larger participation by Latino and Hispanic individuals, and because some of the sites are out of the US, in the 20 to 30% range that we help will allay some concerns in the traditionally disadvantaged communities about the vaccine, as well as being very transparent as we are about who's getting the vaccine, as Dr. Wohl and others have mentioned, and about the side effects and other issues.
There's two things I also want to highlight around vaccine hesitancy. So as a primary care physician, I'm not unique, but I do want to highlight the power of primary care and family medicine, because we have an opportunity to get to know our patients over time, see them at multiple visits, get to know them personally. And so we can start having conversations early on about vaccination so that we empower our patients with the information they need to make an informed decision. The other thing that I want to point out is that very often it's not physicians or health systems that are able to persuade folks to get vaccinated when they are vaccine hesitant. Instead, it's community members that have made the choice to be vaccinated, sharing their story. And so I think that's also the important thing here, is finding that critical mass of folks from communities that are historically marginalized who want the vaccine because they're out there, allowing them the space and the time to get it, and then having them share their stories with their community members. That's the thing that has been shown to change vaccine hesitancy the most.
It's really a great point. And I know we can go on for hours because we're passionate, all of us, about this. In West Africa, we saw the same thing. People did not want to take their loved ones to Ebola treatment units because they never came back. And once Doctors Without Borders started taking down the walls and using mesh netting so that people can see their loved ones and talk to them, then they can see they're getting good care. They saw that the kids had balloons and they had food, and then they started bringing their people. So there was hesitancy to get Ebola treatment, if you will, but it wasn't really hesitancy, it was fear and lack of understanding and knowledge. And when we're transparent, when we share information, when we understand where people are coming from, and that's why I think probably Alexa and I don't like the word hesitant. I think they're making some shared decisions about, given the information they've got. And so we can help them make decisions that we think might be in their best interest, but they've got to make it and just meet them where they are and understand where they're coming from. And I think that's already started to happen.
So Phil, one additional point I'd like to make on what David's, both of them commented on, is that the vaccine allotment that we get as a system each week comes to each of our respective institutions, and we're literally giving every one of those doses out every week. So we're not keeping anything to stockpile for later. We get doses for the first dose, the second dose, and they're being given literally as we get them. And we get notified each week. The next week, the doses are all given out, and then we get another allotment.
Two quick things. One, I want to make sure we put in a plug for our website, and that's for very specifically for patients. That's yourshot.org. And if you want to share that in your stories about this briefing, that would be great, because that is one singular place you can go to get tons of information and to go through the process to sign up for vaccines. So that is yourshot.org. We had one question come in that's really good that I think several people might be interested in. What are some of the stories that haven't been told that should be, as far as the past year and things that have happened? Does anybody have any thoughts on that?
I don't know the story hasn't been told, but I think it really bears emphasis. You know, this has obviously been, as Dr. Meltzer Brody said, a very trying time for everyone in the public. That's why I like the term physical distancing, not social distancing. We really need to stay. It's had devastating impact on people with previous psychologic and psychiatric issues. But I don't think the public has a sense of how stressful it's been for our healthcare providers, who've been dealing with all the same issues all of you are at home, and yet coming into work, extra long shifts, working on weekends, working with critically ill patients, and have come through just with flying colors, not taking vacation time, and just providing just exemplary service and professionalism, while also dealing with all the same issues of schools being closed and lack of daycare and all the other issues that you have there. And I don't know that we've told that story as well as we might.
I concur. And I would say that I think the story that hasn't been told is the enormous generosity of spirit that has just come through. What a privilege to work with such extraordinary people, to see all the little ways people rise to the occasion to go above and beyond across our healthcare system, all of the healthcare coworkers from top to bottom, everyone. And that you see this in the community, the multiple different ways each person is rising to the occasion to try and make this work, to support other people, to be kind and compassionate, to take care of each other. And I think that is so moving and the best part of our humanity. And seeing those stories highlighted, I think really can sustain us. It sustains me. It's the kindness and compassion and people's dedication that sustains us all as we move forward. I just wanted one last plug to say, as a psychiatrist, seeing and North Carolina Department of Health and Human Services move up some really vulnerable groups, homeless population, people living in congregate settings, people with severe developmental disabilities, mental illness, neurologic issues into group 4. Really, as the J&J vaccine rolls out and we can target those very vulnerable groups. But all of these things, I think, are stories to be told. All the heroes here, there, and everywhere that have really just contributed in incredibly meaningful ways.
I think to add to what both of them have said of the the personal impact and the collective impact, people outside healthcare can feel and see, maybe not to the depth that those inside can. So I can look at my little square with each of the people I worked with and tell you numerous stories of, like Melissa talked about, pulling an all-nighter that she hadn't in a long time. Each of them have done something similar to that. But what also has helped us personally and then collectively is the outpouring of, even in a limited understanding of the community support. There have been lots of things that have happened through the year of PPE brought in, food brought in, flyovers, people jumping out of planes into the football stadium. each of those things have a measurable impact on the people here, and just their, again, the mission that we have to take care of the people, to help them get through a disease process that's pretty devastating. That impact of the community support is significant.
All right. Well, unless there are any other questions, we have been on for a full hour. So we will wrap it up with that. And if there's any questions after the fact, you can email Alan or myself. Thank you, everybody, for joining us today. We greatly, greatly appreciate it. Lots of our experts on. It was really good to get everybody together. Just a housekeeping note, we will post this to YouTube as soon as we're able to download the file, and we'll have an audio file as well, and we can get that to you. That's going to be a big one this week. It's typically not that big, but we doubled our time this week. So thank you very much, everybody, for joining us, and we hope to see you again soon. Thanks so much, and that will conclude our presentation for today. Thank you.
Thanks, Phil.